All right, so we're back here for our Myasthenia Gravis Awareness. And today we're talking about energy management. We're going to also talk about conventional therapies. And you can look at my presentation from yesterday talking about the neuromuscular junction and also talking about the adrenal glands. And unfortunately, I did the Instagram live today and forgot to press the record button, but hopefully you caught it live. And this is Dr. Serena Satcher. I have a practice called Regenesis Wellness and Health in Atlanta, Georgia. And I also cover other states, and I have a membership. So no matter where you are, you can join in the membership and come on to our meetings, which are 3 times a month, and have Q&A and also get some education in between. So here we're talking about conventional therapies, and I did discuss yesterday that often in conventional medicine, people believe when they have an autoimmune disease like myasthenia gravis that they think that nothing else with the neuromuscular junctions in their body are affected, but that's very far from the truth. So what's actually happening is that the autoimmunity is being generated by the digestive system, by interface with the environment and the mucous membrane. So I would say the gut-brain connection is the most common thing that's generating the autoimmune response. So what we're aiming to do with therapies is to dampen that response or block it. And in conventional medicine, unfortunately, it's often to wipe out the immune system so the immune system is not reacting at all. So these therapies listed here are the ones, like if you look up or if you are going to see a conventional doctor, this is what will be offered: rest, exercise, physical therapy, steroids, pyridostigmine, immunosuppressants, plasmapheresis, surgical removal of tumors of thymus called thymoma. So next I'm going to talk about energy conservation and pacing. And if you go to physical therapy and get therapeutic exercise, they are going to be focusing on helping you to learn how to pace yourself. And this is with any type of fatigue from any kind of cause. That is what we will do in rehab medicine, is try to get you to have some mindfulness and awareness of what your capabilities are and where your disabilities are. So what your abilities are the most important thing, but having some knowledge of your disabilities is required. And I gave the example earlier of, like, say you had to go to a graduation this time of year and sit outside, and suppose it was somewhere like Texas or Florida where it's like 90 degrees. And often people with fatigue get wiped out when they're out in the elements, in the sun, humidity. So imagine that, you had to park your car at least a quarter mile from wherever it is you're going to sit. And imagine that you're not sure where the restrooms are, and that you may have to walk inside of a building or go to a porta potty to use a restroom. Imagine that you're going to be out there for 1 or 2 hours and that you need hydration, you need some shelter from the sun. But imagine, and this happened to me and my family, and we have, our mother has multiple sclerosis and she's not able to tolerate sitting in the sun. So we went to a graduation, and we knew ahead of time that it was going to be 90 degrees at 10 o'clock in the morning. And she generally does not go outside when it's 90 degrees. But this was for her grandchild. So she put on a brave, front. But also we realized there was no shade. So we had to create shade by getting straw hats. Went to Target and got some hats, had an umbrella that we put over her. We bought water and chilled it. We made ice water in the bottles so that they had something that was cooling. My father's elderly too, and he has some ailments too. So the heat is just not, they're not able to tolerate. So, but they were able to do it. And as soon as our graduate marched across the stage, we ran into the building with the wheelchairs and everything and got them into a cooling area. So, but, people can often have problems with their bladder, have to find, somewhere to use the restroom, so they don't want to drink too much water. We actually saw a lady that lost consciousness in another row, didn't have any shelter from the sun, didn't have any water, had to call the EMTs to come over, and they pulled her out of the place. So this is just a lesson in that, even when you think about the elderly, you don't know what's going on with people. I mean, like I can think of that people with a stroke or high blood pressure should also, be pacing and thinking about how they're going to sustain going to an activity. And you don't want to be such a heavy burden on the emergency system. So there were also trees in the back. And we noticed after everybody was seated and the graduation was going that people that lived there knew to wait until their person that they came to see the graduation of were going up on the stage, and then they would come closer and take the photos and then go way back. The shade was literally like at least a third of a mile away from the stage. So anyhow, I'm going to be talking about lifestyle factors and how we approach helping people that have myasthenia gravis from a holistic perspective tomorrow. So I'll post this when it gets uploaded into the system. And I'll also post the talk from yesterday. All right, I look forward to seeing you. You can check out my website at treatyourselftohealth.com. There's a page, if you go to the contact page, which is if you look across the top and click on contact, you can schedule a free 10-minute session with me by phone. And then you can pay for a 30-minute session if you like, which is less than $150, which is what you would spend if you were going out to dinner for two. And getting drinks. We can meet for 30 minutes and actually make up a plan for you. So I have a membership, which is very affordable. And in that membership, you get some basic education about lifestyle factors, and you also get to have Q&As 3 times a month, in which I meet with the members and they're able to ask any questions they want. Sometimes we go over labs, sometimes we talk about different elements that people are having challenges with. So thank you so much for coming. And I look forward to seeing you tomorrow at 6:30 again for the last day of the challenge. The homework for tonight was what foods enhance how you feel and what foods take you down. And I gave the example that sometimes people eat certain foods that may not affect them on the same day, but may affect them 2 or 3 days down the line, and they're not quite sure what's going on, but I understand it very well. On Instagram, we talked about caffeine and how that can be detrimental to many people, affecting their sleep without their knowledge. All right, I look forward to seeing you tomorrow. Have a great night.